Hello and welcome. Today we're diving deep into the world of gastric polyps. These often silent growths in the stomach lining can sometimes pose a threat, so let's explore what they are, why they occur, and how we manage them. So, what causes these polyps to form in the first place? The exact etiology isn't always clear-cut, but several factors play a role. Chronic inflammation of the stomach lining, often due to infection with Helicobacter pylori, is a major culprit. Autoimmune conditions, such as autoimmune atrophic gastritis, can also trigger polyp development. In some cases, long-term use of proton pump inhibitors, or PPIs, used to treat acid reflux, has been linked to the formation of fundic gland polyps. And finally, genetic predispositions can increase your risk, particularly in familial adenomatous polyposis, or FAP. Now, let's understand the pathophysiology, what's actually happening in the body when polyps develop. Generally, the stomach lining, called the mucosa, experiences abnormal cell growth. This uncontrolled proliferation of cells leads to the formation of a raised mass, the polyp. Depending on the underlying cause, the type of cell involved will vary, leading to different types of polyps. Some polyps are benign, meaning they're non-cancerous, while others, particularly adenomatous polyps, have the potential to become cancerous over time. The exact mechanisms that trigger this abnormal cell growth are complex and involve various growth factors and inflammatory pathways. Gastric polyps aren't uncommon. Their prevalence varies depending on geographic location and the methods used for detection. They are found in approximately 6% of upper endoscopy performed worldwide. They are often discovered incidentally during routine endoscopies performed for other reasons. The incidence tends to increase with age, and certain populations, such as those with chronic H. pylori infection or autoimmune gastritis, may have a higher prevalence. The frustrating thing about gastric polyps is that they often don't cause any symptoms at all, especially when they are small. Many people are completely unaware they have them. However, larger polyps can sometimes have vague symptoms like abdominal discomfort, nausea, vomiting, or even bleeding, which could manifest as black, tarry stools or anemia. In rare cases, a polyp can block the passage of food from the stomach, leading to more significant symptoms like feeling full quickly after eating. Diagnosis usually begins with an upper endoscopy. A long, thin, flexible tube with a camera on the end is inserted through the mouth and into the stomach. This allows the doctor to visualize the stomach lining and identify any polyps. If a polyp is found, a biopsy is typically taken. This involves removing a small sample of the polyp for microscopic examination. The biopsy helps determine the type of polyp and whether it's benign or precancerous. Gastric polyps are classified into several types based on their histological appearance and underlying cause. The most common types include fundic gland polyps, often associated with PPIUs or FEP, hyperplastic polyps linked to chronic inflammation, and adenomatous polyps, which are considered precancerous. Other, rarer types exist, but these are the most frequently encountered. Treatment depends on the size, type, and number of polyps, as well as the presence of any symptoms. Small benign polyps may simply be monitored with periodic endoscopies. Larger polyps, or those that are causing symptoms, are typically removed during an endoscopy using a technique called polypectomy. If H. pylori infection is present, antibiotic treatment is necessary to eradicate the bacteria and reduce the risk of further polyp development. In cases where polyps are found to be precancerous, more aggressive treatment, such as surgical removal of part of the stomach, may be required, although this is rare. While we can't completely eliminate the risk of developing gastric polyps, there are steps we can take to reduce it. The most important is preventing and treating H. pylori infection. This involves good hygiene practices and appropriate antibiotic therapy when diagnosed. Avoiding long-term, unnecessary use of PPIs can also help, and for individuals with a family history of FEP or other genetic conditions that increase the risk of polyps, regular screening is crucial. The prognosis for gastric polyps is generally good, especially when they are detected early and managed appropriately. Most polyps are benign and don't pose a significant threat. However, regular surveillance is important, particularly for those with adenomatous polyps. To monitor for any signs of cancerous changes, research continues to focus on identifying the specific genetic and environmental factors that contribute to polyp development, as well as developing more effective and less invasive methods for treatment and prevention. Recent advances also explores targeted therapies for preventing growth and progression of cancerous polyps.